Today we're going to be talking to Janetta Webb. Janetta is a pelvic floor physiotherapist, and she's going to discuss with us how physiotherapy approaches the treatment of pelvic pain. Hi Janetta.
Hi Louise, thank you. So your GP or your specialist may suggest to you to come to see a pelvic floor physiotherapist if you have issues with pain in the abdominal area, the pelvic area, the vagina, or the vulval area, which is the labia and the area outside to the vagina. Usually, of course, your GP or specialist will have thoroughly investigated any possible causes for this pain, and you may have had tests, but then he or she may feel that perhaps there is a muscular or nerve component that's contributing to this pain, and so therefore they'll suggest that you come along to physio.
And on that first visit, that initial visit, what would happen?
So, an initial visit, a lot of the time we're talking and I'm asking you all about the history of the pain. So what's the story of it? When did it start? The severity of the pain, so how you would describe it in your words, the nature of the pain. When does it come on? Is it there constantly, or does it come and go? If it does come and go, are there particular things that cause it to come on? So, for example, a lot of women that I see don't have ongoing pain during the day, during their usual daily activities when they're out and about or at work, but they may only describe painful intercourse. So, there may be specific times that you're experiencing discomfort. The same thing, as well as what brings it on, other things that the woman's been able to do that help to reduce the pain.
And what about how the pain interferes with a woman's life? Is that important to your assessment?
Look, it really is, because of course that's why you're here. So, you're here for us to discuss what activities is the pain limiting you from doing, and therefore what are our goals in that you would like to be able to get back to a particular form of exercise, or comfortably being able to have sex, or you'd just like to get through the day, being able to do that with no pain at all.
And what about history, Janetta? Is that important?
Yeah, so quite often your GP or specialist will have given me some notes of your history, but I'm interested in any other medical issues that you see your GP or any other specialists for, any surgery that you've had in the past, any medication that you're taking, because even though you may not think it's particularly relevant to this area of your body, certainly it may be. For example, a lot of women experience issues with their pelvic floor muscles if they have ongoing issues with back pain. So at the same time as seeing me, it may be important for me to encourage you to continue to seek ongoing treatment for back pain.
And what about the bladder and the bowel? Is that related?
Yeah, so very much so. So particularly when we're specifically looking at the pelvic floor muscles, which is the sling of muscles that supports the pelvic organs, and it goes from the pubic bone, so the bone right down low in front, right in between your legs, and attaches onto the tailbone and onto the sit bones. So the pelvic floor muscles, they provide support to your pelvic organs, but they also play a big role in bladder control, of course in our comfort and sensation when we're having sex, and also in bowel control. So a lot of women that I'm seeing for issues with pain, may also come to see me with bladder or bowel issues too.
And do you need to have discussion or contact or communication with other health professionals that the woman might be seeing?
Look, I'll certainly keep in touch with the person who has suggested to the woman to come to see me, but it's also often appropriate to chat with a psychologist or dietitian or even personal trainer or Pilates therapist, any other people that the woman is seeing that may be relevant in the management and the reduction of this pain. But of course all of those would be with the woman's consent.
And after you've seen the woman and you've found out this history, what happens next?
Okay, so then I will talk to the woman about what I feel is causing her pain. So with that comes the use of diagrams and models to explain abdominal and pelvic anatomy. So that will involve muscles, joints, ligaments, bones, all those sorts of things, as well, of course, as nerves. So I'll really talk to the woman about how her anatomy is being affected by this pain, and therefore that hopefully will give her a good understanding of then, how we're going to progress on to treatment.
And what about examining the woman, Janetta? I guess that's part of the assessment as well.
Of course. So I will always discuss with the woman what I would like to do in terms of an examination, and initially that may involve a postural assessment, looking at the lower part of the back, looking at the tummy, the hips, that sort of thing. So initially it may be an external assessment only. Anything that I'm going to do I will always discuss in detail with the woman, and only do anything, of course, that she feels completely comfortable with. And of course, because many of these issues do involve the pelvic floor muscles and the deeper muscles, then a vaginal examination is often necessary. However, as I just said before, that's only if a woman feels completely comfortable to have this examination. And when I initially see a woman and perform a vaginal examination, it would never be with any instruments, and it would be always very gentle and with the aim of not causing any discomfort at all. But I'd never like to think that a woman wouldn't come to physiotherapy because she didn't want to have a vaginal examination, because there are so many other things that we can do in the reduction of pain, and we can talk about that as we get to know each other if I feel that that's appropriate.
And after the examination, the next stage, I guess, is working out what treatment is required.
Exactly. So then we'll make a treatment plan with some short-term goals and long-term goals that the woman, as well as me, feels are appropriate for the management of her pain. So these will involve lots of things. So they could involve postural education. They'll certainly involve some sort of muscle education. So it may be that a woman's pelvic floor muscles are what I call overactive. Sometimes people will refer to this as muscle spasm, or women may have heard the term vaginismus. So that's the medical term that describes overactive pelvic floor muscles. In that case, then I will be helping the woman to teach her muscles to be able to let go rather than to tense up. Maybe they're tensing up all day, or maybe they're just tensing up in particular situations in response to pain. And that will be with exercises. There may be exercises to strengthen the muscles, so it may be that we need to get better support or control or coordination of the muscles. As well as this, if there are particular issues with the muscles being overactive or tight areas in the muscle, then specific physiotherapy treatment techniques may be something that I will use to help to release these tense areas in the same way that massage in other muscles of the body would be used. So as well as those techniques, a woman will always have exercises to do at home, so you don't get out of a physio consultation without a little bit of homework, some exercises to practice, and we'll review those at each visit. And then we may also use what I call adjunctive therapy. So it may be that I suggest to the woman that we need to use some biofeedback. So that may be with some sticky pads, a bit like Band-Aids on the skin on the outside of the body, or it may be with an internal vaginal sensor that picks up when the muscles are working, when the muscles are releasing, and particularly when they're doing what we want them to do. So that's a really good way for the woman to get some feedback as to whether her muscles are training to do the things that we're encouraging them to do. Sometimes I use TENS therapy, so lots of people have heard of TENS for pain relief in other areas of the body. It stands for transcutaneous, which means across the skin, electrical nerve stimulation. Can sound a bit scary, but it's a very comfortable technique that's with a take-home machine that women can help to reduce pain in all areas of their body, but also the pelvic area. Something else that women have often heard about is the use of vaginal dilators. I like to call them vaginal trainers, so I'll show you a vaginal dilator. So it's a small instrument. It's a little bit like a small tampon. This one's made of plastic, so quite tiny, and the vaginal trainer is something that the woman can use herself at home to train the pelvic floor muscles, if they are overactive, to let go. So I think the use of the word dilator sometimes may have the connotation associated with it that suggests that there's something forceful about it. So certainly there isn't. It's really placing something on the muscles and encouraging the muscles, instead of tightening up, to be able to let go. So certainly any of these techniques or therapies that we use, I would always discuss in great detail with the woman first. And some women feel comfortable using some techniques and not others.
There's lots of options.
There sure are, and I was about to say we mustn't forget the use of warmth. Warmth is really good for muscle relaxation, and also for women's finding that her pain is more like stinging or burning. Cool packs can also be really helpful. So lots of very simple things.
So how long do you imagine the treatment would be? I guess it depends on what the problem is, but...
Of course. So an initial consultation, so the time that we would be together, is approximately an hour, and each visit after that is approximately half an hour. And most women I would see over a period of at least 3 months. Sometimes it sounds like a lot because, of course, by the time you get to me, maybe you've seen a few other people and you really want a cure for the pain as quickly as possible, and I totally understand that. And, of course, I'll help you to find that. If you only need to come and see me a couple of times, then that's great. The most important thing, of course, is that your pain is reduced or eliminated. Sometimes, however, problems can be more complex, and I can be seeing a woman for 6 to 12 months. But along the way, we'll always be discussing how do we both feel that things are going, and involving any other health professionals that we feel, that we need to involve. One thing I also didn't mention, I mentioned briefly before personal trainers and Pilates therapists. It's really important for us to discuss what sort of activities and exercises you're doing outside your specific physio exercises, because while it's really important for us all to keep fit, and I can advise a woman as to the most appropriate types of general fitness to do, I'm also really keen to review her specific exercise program. For example, if she's going to gym, because occasionally there can be some unhelpful exercises that a woman might be doing that might be causing more tightness, or inadvertently actually more irritation of the nerves or more pain, when in fact a woman's just doing those exercises to try to relieve things.
And June Hales has some really good books actually about pelvic floor safe exercises too. Yes. So certainly if you wanted to have a look on the Jean Hales website, there's lots of information there about all of the things that we've talked about today in downloadable fact sheets, and you can certainly download those or read them online for more information. And I really like it when women come along and they've read lots of information, and then we can sift through, okay, what's relevant and important for us to discuss today. That's fantastic, Janetta. I think you've done a really great job in demystifying what's going to go on at your visit with a physio, and also taking some of the fear out of it, I think, which will make a big difference.
Yeah, great. Thanks, Louise.
Thank you.